So in this video, we're going to talk about glaucoma. First, we'll talk about acute closed angle glaucoma. For this, the symptoms will appear very suddenly. They'll have severe eye pain, blurry vision. Patients can also complain of nausea, vomiting, headache. When you look at their eye, it'll be really red. And also, like a classic buzzword is a fixed mid-dilated pupil. So when you test their pupillary reflex, that eye won't have like a reflex. It won't be reactive. Glaucoma occurs when you have a quick increase in intraocular pressure, which can be because you create a lot of aqueous humor or you're not draining it appropriately. To officially diagnose glaucoma, you have to do a gonioscopy, but a tonometry, which just measures the pressure of your eye, can also be helpful, and you definitely need to get an urgent ophthalmology consult for these patients. Now, to talk about open angle glaucoma, so this type of glaucoma happens over time, so it's not like suddenly it comes on. They progressively get loss of their peripheral vision, so they'll kind of develop tunnel vision over time. And when you look at their eye through a fundoscopy, they have an increased cup to disc ratio, so you'll see more cupping around the optic disc. Now, to treat glaucoma, there's several different ways to treat it. In my mind, I separate it between their mechanism of action. So first, you can just decrease the amount of aqueous humor that your eye makes. You can do this by giving them alpha agonists. You can topically apply beta blockers like timolol. You can also give diuretics like acetazolamide and mannitol. You can also treat glaucoma by increasing the drainage of aqueous humor. So you can do this by giving pilocarpine. You can also do this by giving prostaglandins, which all end in prost, like bromatoprost. You should never, though, give any medications that would dilate your eye because that'll make glaucoma worse. So no drugs that increase sympathetic activity or any antimuscarinic drugs which indirectly will cause more sympathetic activity. So like atropine or trihexylphenadil. Never give them topical steroid drops as well. Other triggers that can bring on, especially the closing of glaucoma, are like walking into a dark room, because when you walk into a dark room, your eyes suddenly dilate more so that they can bring in more light so that you can see. Also, antiemetics and decongestants can also serve as a trigger for glaucoma.